today I will be speaking on the role of most important complications what we encounter that day-to-day practice, that is hypoglycemia. So exactly what do you mean by hypoglycemia? This in the sense when the blood glucose levels falls below 70 milligram per deciliter, that is from the expected at least minimum value, then we can experience this term called the hypoglycemia occur. And who is more likely to have this sort of problem is that the patients with the type 1 diabetes, or the patient those who are on insulin or other oral hypoglycemic agents, or the elderly patients, or the very younger patient, those on multiple doses of insulin, or the patient which are having cognitive impairment due to the elderly patient, they may be either skipping or adding more amount of insulin. So these are, if you are doing fasting, so after feasting, so this is also maybe you can experience the hypoglycemia. So when the blood glucose falls below the required level. So what are the coming to the symptoms of hypoglycemia? In the sense people may experience like a patient shivering, shaking, lightheadedness, or sweating, or increasing hunger. So these are all the commonly experienced symptoms of hypoglycemia. And if they're coming to the hypoglycemia, there are two varieties of hypoglycemia in the sense from the degree of sugar level, that is mild to moderate, that is when the blood sugar falls between 55 to 70, it is known as mild to moderate, or severe in the sense when it falls below 40 milligram per deciliter, it is known as severe hypoglycemia. So in that term, severe hypoglycemia, even you may fail to experience such symptoms, and you may go into seizures or loss of consciousness also. So that is where you may need an attendant to overcome this situation. So what happens if you have encountered this hypoglycemia during sleep? So how do you know it? So in the sense that patients may experience sweating, or where your bed linen may become wet, or your garments become wet, or you may be feeling as irritability, confusion. So this at times, or maybe your friends and family may experience such symptoms. So what to do if you face such type of symptoms? That is means especially if you come to the people those who are commonly experiencing hypoglycemia, in the sense people those who are, what I've said already, that is patient those who are on insulins multiple doses, or patients with anti-diabetic drugs, and patient those who are either very young or very old, and patient those are impaired kidney functions. Because why these impaired kidney functions experienced patients experience hypoglycemia, in the sense because of the loss of kidney function, the insulin quantity they keep on adding in the blood, so that the doses of insulin needs to be titrated on frequently. And patient those who are having alcohol or empty stomach, they may experience also this hypoglycemia.